Hello, students. We've been doing this for 8, 9, or 10 months, and you have been practicing massage from the very beginning. So this chapter, chapter 10, is a review, and you will pick up nuances that you haven't sort of processed before. This would have been described and assigned in some of your module education that you have with Luke, and also with me after the midterm. And there's lots and lots of videos to help you reinforce this and pick up efficient ways to do massage therapy for people. When you're going through this chapter, you still need to pay attention, because this is the languaging that is likely to show up on the NBLEX exam. So here we go. Let's go down to chapter 10. So the biggest concern relative to this chapter is the language. We just, as massage therapy community, don't use a consistent language. It's kind of like an essential science when we're studying the muscles. I have to have 4 different terms because I don't know for attachments, because I don't know what you're going to get. So this is where we're at. And as I have mentioned earlier, I follow along with the recommendations of the entry-level analysis project, which is reflected in the licensing exam. So the first part of this is going to talk about some of the mechanisms of what happens to the body and how it's processed when we apply a mechanical force. Then we're going to look at massage techniques using joint movement, very important. And then an intervention process here specific to the joint movement setup is our muscle energy techniques. And then how to do a full massage. So objectives, key terms, terminology used to describe massage. So slow down and read this. All I can do is reflect the current status. You know, if the world revolved around what Sandy said, it would be different. But as it stands right now, you do have to process multiple names for essentially the same thing. So as you have learned to perform massage, you had to first learn about each individual method and the body mechanics that went with that. And then you needed to combine those. And then those same skills became assessment. And were further refined to provide interventions if indicated based on the assessment. So you've seen this before, massage by the numbers. This is our main platform of application and languaging to describe it. And then the other thing that is important in this chapter is to think about the quality of our touch. And, you know, that evolves with experience as well. Way, way back in the day, Gertrude Beard, I never met her. I would have liked to. Actually captured this type of language in her initial book called Beard's Massage. So read through this. This should feel familiar to you, along with the variety of pressure scales. This one happens to be here with Tracy Walton, who I very much admire. She developed a pressure scale, and there's one in chapter 8. So different ways to describe and apply pressure, and what happens when a force is applied, and how to individualize that. So where, how intense, direction, drag, speed, pacing, rhythm, sequencing, frequency, duration, intention for the outcome. These are all pieces of quality of touch that in my research that were first described by, that I found was first described by Gertrude Beard. And this shows up in the ELAP, entry-level analysis project language. So we have to make our first contact with our client, and we have to think about the various positions we're going to use. And then we have to take a look at and understand the mechanical forces. And again, this is review for athletic. I'm looking at Albert Baumgardner here. For Health Enrichment Center students. And but as I've mentioned previously, other instructors will use these videos to inform themselves and other schools. This is one of my most favorite forever quotes. Massage must be simple. Many endeavor to introduce improvements into the science of massage, but fail to gain adherence to their preventative methods. It would be well to advise these witty inventors of new sub-methods to keep their improvements to themselves. Okay, so soft tissue deformation, that is what we do. Here are the various methods that we use to do that. Each of them is going to be described with illustration. And then the actual massage manipulations and techniques, the actual mode of application, the way we push, pull, press, and twist to load the tissue. So how that is modified is here. These are things that should be familiar to you. And here's kind of a little example of the conundrum we find ourselves in. There's something out there, you've probably heard of it, deep tissue massage. I've never known what they meant by that. So it appears to be an adaptation of a push or pull force with enough magnitude intensity to load, change the shape of the deeper point of application tissues with an intention of therapeutic adaptation primarily through the nervous system of the body. Try to practice, not try to, do practice describing the various methods that you might see demonstrated. Maybe you're watching a demonstration on a YouTube channel other than Luke and I, and that's good. That's good for you to do that. It gives you another perspective. But certainly don't pick up the bad body mechanics habits and see beyond the jargon-based terminology that you might find, or some of the classical terminology that's found with Swedish massage, and see if you can explain what you're seeing in the way I just did in that example. Mechanotransduction describes physical forces and how they are converted to an inside the cell biomechanical response. And this is where I've mentioned previously that massage can downregulate the inflammatory response. It has to do with transmitting information through mechanotransduction. So here are the methods and the variety of names. Static methods, resting position, holding. And then theories of effect. What do we think? What is our evidence-informed and biological thought process around why this is a beneficial thing to do and its potential for reaching the client's outcome goals? And then how you apply, and then a nice little picture. So practice, the proficiency exercises always gives you a reinforcing practice suggestion. So, follow along with those. Then we have compression, the definition, a sense of picture. Compression goes 90 degrees into the tissue. There are multiple names: direct pressure, ischemic compression, or inhibitory pressure. Direct pressure is a common way that people will do an intervention or try to change a trigger point. So sometimes you'll see that connection of words. The theories of effect. This is our evidence-informed idea of how we think it works, and then how to. So one of the key components here is that it's 90 degrees against the tissue. So it's going to thin it in the middle and push it out around the edges, but we apply it at usually a slope or about a 45-degree angle on the client. So the 45-degree angle here at the shoulder against a 45-degree-ish angle on the client. When we come in, we've got our 90-degree contact. So some more proficiency exercises here, and these are fun to do. One of the things that it'll suggest is that you do a practice massage using only compression. And compression over loose clothing is a main approach, along with rocking and shaking and joint movement, for the mat-based methods. Shiatsu, Thai, though a lot of it is cultural, a cultural influence where the method is performed on the floor or on a mat or on the ground. So gliding, stroking, also in the classical system or Swedish massage system, effleurage. So ELAP uses gliding and stroking. So, but you may encounter a question on the NBLEX that uses the term effleurage. And if they are talking about specifically the Swedish/classical form of massage, then, and they're asking about terminology that has use connected to that specific form, then it would be appropriate to use effleurage. But it's not accurate to use it in any other set of circumstances. So it's a French word that means to skim or to glide. And it's one of our most common methods, that and compression. And it typically will need a lubricant, whereas many of the others do not. Theory of effect, and then some suggestions on how to practice and perfect it. So here's your applying, and it doesn't always have to go in the fiber of the direction of the fibers here. It can go across too. So one of the things that you have learned is to go with the grain and across the grain, with the grain and across the grain. It just has to do with the angle you come in at it with. Your excursion with gliding is how long it is. And one of the things that the ergonomic studies showed that it's very hard on the body to do very long glides. You're better off doing a series of short glides, and so your excursion is only maybe this long. But you would move your feet and you would connect those into the sensation of a long stroke. So here's some examples. And then kneading. Kneading almost always is going to go across the fibers. So it is historically, then, this is the Swedish massage overlap is petrissage. So you may identify this on one of the NBLEX exams, or if you're reading a piece of research or something. You want to connect these two words together. Skin rolling or fascial rolling is a variation. Here's your theories of effect. When we talk about what tone is here, and again, this is a language issue. Tone, resting muscle tone, is the tautness, stiffness, tension in muscle at its resting period. It's not in a concentric action or eccentric or isometric. It's just there. And it has multiple elements that produce that. So one is the nervous system, and that's the relationship of the fibers together. And the other is its stiffness or pliability. And that has to do with the connective tissues and the fluid component. So muscle tone is the nervous system, and then stiffness has to do with these other elements. So we get a little bit in here on how kneading is a good method to reduce stiffness. And then here's your application. And your activities to perfect this. Now, shear stress or friction methods are typically an intervention method, whereas these others can be general massage application along, and then that becomes assessment, and then they also can become, with adaptation, they can become the intervention. But friction is usually primarily focused on addressing a tissue that is either stiff or is not sliding very well. It's also used to create a little bit of controlled inflammation in an area that might trigger a tissue regeneration process. Elongation. This is taking things apart. This is a entry-level analysis project, Word. It is not specific, it's an aspect of stretching. If you're going to stretch something, you have elongated it. So, but stretching is where you move beyond the physiological range and try to extend that range a little bit. So you have to think back to your essential science studies when we were looking at the joint chapter here, as well as the muscle chapter. So this box right here, I actually know Paul Stanley, and he's done a lot of research relative to massage therapy, and he actually was the scientist way back in 2007. I may have mentioned this in the research chapter, where he was at the initial fascial research conference, and he stood up on the stage in front of all these people that are manual therapists and stuff. And he says, I have no clue what you're talking about. Yeah, all these names for this stuff. He's a bench scientist. I can't study that for you because I don't know what you're talking about. And so that was also supportive in this idea of what happens when the tissue deforms with these methods. And he can study that, or we scientists can study that. So another example of how this unique modality-based language interferes with us interfacing effectively with the scientific community. So he studied how long you need to stay at that end range, that range of the soft tissue as it comes to its natural stop. And if you want to change that and make it have a little bit more flexibility in it, make it a little longer, how long do you need to do that, and with what intensity do you need to do that? Because a big concern is that people are overstretched, and they are stretched. The connective tissue is made more lax when underlying laxity is the problem and hypermobility is the problem. So this box gives us ideas about how far and how long that tissue needs to be loaded to get this elongation effect, and an activity for you to do that. And so here are the pictures on this. So, kind of play with this with a rubber band, and you will see once we get down here that you only need to go about yay far on once you reach end range on tissue, you only need to stretch about this far, move it beyond that range, not very far. And then this is how you would determine that bind, that drag, using drag to come to a tissue bind. And you can practice that using a piece of paper towel. So this is a pool noodle, trying to help visualize the idea of elongation along the direction of fiber using a tension force, and elongation across the fiber direction using bending. So here are a bunch of examples of that. And then how to apply an elongation approach. So here are some alternate procedures to that, more around direct tissue stretching without moving the joint, working across the soft tissues between joint rather than straining the joint directly. and then a little bit of discussion about how do we and can we, is it biologically plausible that we can get into some of the deep fascial planes? And maybe, the answer is maybe. Traction is an elongation approach. That the thought here is to apply enough elongation force to bring a little bit of separation into the joint structure. So oscillation is a back and forth, and oscillation, shaking and rocking and vibration, and especially shaking and rocking are excellent methods. They're underutilized, and they really stimulate nervous system responses. And then it gives you, now vibration is really, really hard to do. And there are electronic devices that can do that. Same with percussion. And so that you need to make decisions. If this external device can do it better than I can, then, the device may be the better choice. And most state legislation will say use of external and electrical devices that mimic what the hands could do. So again, some activities that can help you perfect the movements around that. So here's shaking, and I've already mentioned it's a really important method and how to do it. And you can shake the tissue, or you can shake a limb. So the tissue is, when you shake a piece of tissue, is not going to move the adjacent joints. But when you shake a limb, you're going to get movement into the joints as well. Rocking, moving around the body and rocking the body is soothing. It's an excellent assessment, and I use it as my main transition from one part of the body to the other. Percussion is historically, it's got the tapotment term associated with it. It's more of a stimulating technique. It's an up and down sort of a abrupt force onto the body. And it tends to bounce off. So I don't use it a lot during massage because it's energy using on my part as a massage therapist. I use it more as an intervention. So percussion, if there is some chest congestion, or if I'm trying to stimulate some joint mechanoreceptors or muscle tendon receptors, I might use that abrupt stimulus response there. But it's more advantageous to use a percussion device. Just got to be careful and cautious with it. If you're going to use a percussion device, make sure that you read all the instructions and that you work with it cautiously, not up onto the head, and keep it focused, not right on the bony structure, but around it. Now, these are forms of percussion. They may show up, so you're going to want to know what the hacking and the slapping and the tapping is, and then here's the examples of it. And then joint movement techniques, active and passive, rhythmic movement of the joints, and that easily moves into an assessment along with intervention. very important. So this is from George Taylor and his sketch of the movement cure, which is what Swedish massage sort of kind of was initially called. So it's kind of fun to look at all of that. And so here are the principles that were broken out. And there is confusion around joint movement and range of motion. Sometimes the terms are used interchangeably. Range of motion is a measurement. It is the angle through which a joint moves from the anatomical position to the ends of its motion in a particular direction, and it is measured by degrees. So each joint has a normal range. And this is discussed in the Essential Science book as well. How much range there is determined by a bunch of factors here. And if it is an open chain or a closed chain. And to understand this, we need to review joints. So that's what this is. And then joint movement as assessment. So to get a joint, to move a joint through, to measure its range of motion, we use joint movement. We don't do range of motion. We measure range of motion. We can do joint movement. We can do it passively. The client can do it. We can help them. And you're going to have all that terminology. Just, you may find the term joint movement and range of motion. Range of motion may be used for the doing part, not just the measuring part. So here's the range of motion, because it's the measurement of the major joints. You're going to want to have a working knowledge of this. Besides, you should be moving all these joints as part of the massage anyway. And then moving joints is how we position an area to elongate it, to move it to its physiological or pathological barrier, to stretch it and move it beyond those barriers. Here's the theories of effect. And then some caution here, particularly around the range of motion, whether it is hypermobile or hypomobile, is often, especially hypomobile, is a resourceful compensation. And it's the soft tissues around the joint that stiffen and increase in neurological tone if the underlying structure is lax or unstable. So be cautious. And then here's where I talk about this range of motion conundrum and the issue around terminology use. So we have active where the client does it, and we have passive where we do it. And active movement can also be, there's variations. The therapist can help them movement, active assisted, or the massage therapist can challenge it and provide a resistance against which the client moves. So here is more example of that, and you have practiced all of this. So here's the suggested sequence. There is a natural protective mechanism, and if a joint is moved passively, it's going to probably have less range of motion than if the client moved it themselves. So if you're really narrowing down and assessing the quality of the movement of a joint, you would want them to move it first. If you're incorporating joint movement generally throughout the massage, that's usually passive and followed by some followed by some rocking and shaking or part of. It is joint movement with rocking and shaking. And then if we want to do some muscle testing or testing for the integrity of the joint, we can have them push back against a resisting pressure that gives us an assessment on how the local jointed areas working, as well as they're recruiting a lot of other muscles. And then you can that's also a strategy if the client is very choppy with their movements or won't let go, that maybe they need to push against something that might help them let those tissues relax a little bit better. So passive joint movement also just support circulation and lymphatic fluid movement, and it should be incorporated into every section of the massage unless there may be a contraindication to it. Okay. This then can be, so you would do an assessment with joint movement and you would identify the range of motion of a joint. If it is hypomobile and there is an indication that that is not resourceful compensation and that it would be beneficial to increase the range of motion a few degrees, then a really good way to do that is muscle energy technique. So this is always an intervention. And there's different kinds, and here's the history on this. But what it involves is a voluntary contraction of the client's muscles in a specific direction against a force provided by the massage therapist or other manual therapist. And it works through the nervous system. And if there is if the hypomobility, if the reduced range of motion has to do with a guarding response that's not necessary anymore, or some kind of a neurological imbalance between agonist and antagonist or other functional muscle units, then this kind of kicks the nervous system's attention into gear, and then that area is able to move into a more normal function. With stretching, you're moving into the bind and beyond the bind. So that's called a direct method. And in terms of the nervous system, it may be better to move into the ease first, the way the body wants to go, instead of trying to pull it out of that. So if my elbow, if I can't get it to fully extend, instead of yanking it into extension, what I might do is actually take it more into flexion, maybe with a little rocking and shaking, and let it stay there for a minute, and then tease it out. Have me push here, tease it into a extended or a improved range. So these are the theories of effect. The general idea now is that pushing and pulling increases the tolerance to a stretch sensation. And then here are the various ways that you can apply this. So because this method uses a specific type of a muscle contraction, it's important that you have the terminology and the definitions of that. You could find a generalized question about muscle energy technique on the MBLEX exam. This is oftentimes a more a methodology that is provided beyond entry level. It is so valuable in terms of an intervention that we feel it's important to include it at entry level. And that's why it's here in the textbook where it is. Okay, this continues to tell you how you're going to apply these muscle energy techniques. This is not a battle. The contraction that the client provides, the push that the client provides, or the pull that the client provides is not at maximal strength. It's much, much less than that, more like 10 to 25% of their strength. And it's fun because of the various eye reflexes, especially if you can't get a person to push or pull with a reasonable force, you can still initiate the neural responses by having the person move their eyes in certain ways, and that's explained here. So you've got agonist contract, also called contract, relax, or hold, relax. And here, and then you have antagonist contract. So you can get mixed up on this if you don't keep in mind where you're trying to create the length. And we call that a target muscle. So it's really helpful just to combine the methods. And then if the area, you can use pulse muscle energy. It's where you go pulse, 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 pulse. You can use this approach both to increase the range of motion measurement, but if an area is hypermobile, there isn't good tone in the muscle, it feels flaccid, you can try to engage that nervous system by having them pulse, 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 and then go in the other direction, pulse, 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 pulse. And you've got a little bit of a, push, 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 push. Really good for hypermobility. These are hard to determine with the figures. That's why the videos that accompany this chapter are so important. Then you can sort of mimic some of this by pulling or stimulating the proprioceptors in the muscle, and that's what this is about. And then positional release, strain, counter strain is the way you move the body into ease. And a way to find ease is to move it away from the pain or away from the discomfort. So if it hurts for me to move my head like that, then I would find a way to move my head where it doesn't hurt. And then we would start there and calm the nervous system, and then start to tease it into the movement that is what we're trying to address, what we're trying to increase. So here's a step-by-step on this. And then putting it all together, that's what this integrated approach is. And then course, I like to remove complication. And so here is the pulling all of this together and making it simple. The next part of this chapter is how to pull this together into a full body massage. So Luke starts you out with a sequence, the massage maps, so that you know how you're going to move from one part of the body to the other. And then methods are introduced, and then methods are combined, and so forth. So general principles, and this may show up on the NBLEX exam. General to specific to general, superficial, deep to superficial. Transitions have to do with how you move from one method to another and how you move from one body area to the other so that it feels unified. And here is a suggestion. There are more than one suggestion, but this is a way that is a good way to sequence out a full body massage. So it talks about the various methods and when it would be advantageous to use that method. So that's talked about. And then here's a general sequencing and how to move around the body. And then some suggestions for adaptation around body hair, skin problems, how to avoid tickling, and some considerations and suggestions by body region. So the head and face, key points, the neck, cervical area, key points, shoulder, arm, forearm, wrist and hand, chest, anterior thorax, abdominal massage, and sequence here. So general abdominal massage should be part of every session, unless somebody has a contraindication for that, or they don't want you to do it. To specifically massage the colon to support fecal movement, that's an intervention. And here's a sequence on how you can do that. Here's the back, hip, leg and thigh, thigh and leg, ankle and foot, and then instruction on how to actually design a massage. And it asks you to sit down and sequence out a script for a massage here. So there are a whole series of pictures here that show a sequence. And my suggestion is that you try to mimic this. And then you start looking at how you would adapt and modify based on a client. If you do this fast enough, it almost looks like a little movie. So here's your general abdominal massage. Hands. It gives you ideas for positioning the body that you might not have thought of. Then there is a sequence for seated in the chair. And again, lots of support videos on the Evolve site and the YouTube channel. And then here's Matt working on a mat. So, I'm gonna pause the video for a minute here and go to the Evolve site and show you where those videos are. So here's your Evolve site for fundamentals. I'm gonna click on that. And we're gonna go down here to student resources because you're a student. And then we want to go down to chapter 10, because that's the chapter we're working in. Of course, here's your required chapter test, and right here's where the videos are. So if I click on that, you'll see all the different options you've got right here. So there's content here on the muscle energy techniques and different types of joint movement and so forth. All right.